I'm Dr. Seth Eberlin. I'm a board-certified plastic surgeon here in Walnut Creek, California, and today we're going to be talking about my two favorite non-surgical treatments that we offer here at the office. We're going to talk about them separately and then kind of how they can work together to help improve what we're looking at. So the two things we're talking about, number one is semaglutide. So you may have heard of it called Ozempic or Wegovy, but those both fall under the generic name semaglutide. I tend to stick with the generic only because I know that it is a tried and true, kind of coming from a very effective pharmacy where we know that the product is exactly what we want it to be. So that's the first treatment. Second treatment is called Emsculpt, and it is a non-surgical way of helping to tighten up your abdominal muscles and improve your core strength. But first we'll talk about Ozempic or semaglutide. Semaglutide is a once-a-week injection that helps to, in essence, make you lose weight. And it does this by a few different avenues. Number one is it helps to regulate your blood glucose levels. So it keeps your blood glucose lower and more stable, so your body doesn't go through these big pre-meal dips where your brain says, I need a bunch of food, and then you eat a lot and your blood sugar spikes, and then your body releases a whole lot of insulin, which downregulates your glucose. So you kind of go through this roller coaster. With this medication, it helps to keep much more even, much more stable, which helps to reduce those hunger hormones. That's another thing that this product does, is it downregulates your body's production of the hunger hormones. So the thing that tells you, hey, I'm hungry, you don't get that as much. So when people are on this medication, a lot of the time they get the question, oh, well, am I gonna feel hungry all the time? The good news is you don't. And you don't feel hungry because your brain is not getting that signal that says, hey, you need to eat more. In addition to that, the other thing that it does is it decreases gastric emptying, which means it slows down the passage of food through your GI system, so your stomach is full for longer. So in addition to decreasing the hunger hormone, you also have more food in your stomach for longer, which tells your body that you don't need to eat. All of these things just contribute to us being able to regulate our dietary intake better, which helps to stabilize our blood glucose better, which in turn helps us to lose weight and be a little bit more healthy, which is really, really nice. Especially because you don't have to fight those cravings. You don't have to fight the desire for hunger. You don't have to fight the, ooh, I'm walking through the kitchen, I want to grab one of these or grab one of those. You don't have that stimulation anymore. Now, it is, like I said, a once-a-week injection. My typical protocol is I bring patients in, go through a consultation with them, talk to them about the importance of maintaining protein intake, maintaining adequate water intake, kind of focusing on the dietary aspect of it. And then every month or every 4 weeks, we bring you back and kind of reevaluate where we are on our weight loss journey, how close we are to our goal, and what we may want to do to adjust our dosage up or down. This is not a one-dose-fits-all medication. This is something that you can very easily titrate it up or titrate it down based on how fast or how slow we're losing weight. I tend to take a very conservative approach with this. I'm very much a safety first type person, so what I don't want to do would be to start out with a really high dose and have it kind of shock your system. Yes, you're losing weight, but it's not maintainable weight loss. Because if you take a really high dose and then just come off of it, yes, you will lose that weight, but it's almost like a crash diet where your body's gonna put that right back on. If we keep a nice low dose for kind of a more extended period of time, it becomes more of a habit. It becomes more of your daily ritual, and it just kind of fits more into how we act every day. And that's a much more sustainable thing, because the goal is not for somebody to be on this medication at all times. The goal is to help us use this medication to get to where we want to go, get off the medication, and then stay there. So a lot of it is about modifying our dietary activities and also what we're doing as far as just physical activities go. Kind of modifying our lifestyle is a really important thing with this, but using semaglutide is a very good way of kickstarting it and getting us into that new set point. Again, the biggest thing is coming in for a consultation. We spend a lot of time talking about it because it is really easy to get this online. Problem is when you're getting it online, number one, and at least in my experience, it's a little bit harder to trust the actual medication just because you don't know the quality of it or how it's been maintained. The other thing is you're not really getting a personalized directed plan. It's more of a one-size-fits-all approach, which usually doesn't fit anybody. So that's my opinion on that. Now the next treatment that we're talking about is Emsculpt. And what Emsculpt is it uses electromagnetic stimulation to contract your muscles. Typically it's either your abs or your butt, and it's done over 4 treatment sessions over a period of 2 weeks. Each treatment session is 30 minutes long, and each treatment session consists of 20,000 contractions. So the easiest way to think of it is you come in for a treatment, it's 20,000 sit-ups in 20 minutes. Now that would be really stressful and really harsh on your muscles, but the way that this machine works is it helps to flush out the lactic acid during the procedure, so afterwards you're not incredibly sore. Now this does a couple things. Number one, it really helps to tone and strengthen your muscles. And the way that it does this that helps to make it long lasting, if you go to the gym and exercise, your muscle fibers get bigger. That's called muscle hypertrophy. And muscle hypertrophy is very transient, meaning that if you work out and you work out and you work out and you get nice and big and strong and you stop working out, your muscle fibers are going to very quickly shrink back to where your baseline was. What Emsculpt does is, because it stimulates your muscles to the point of what's called supramaximal contractions, it stimulates muscle hyperplasia. And what muscle hyperplasia is you're actually, instead of growing bigger muscle fibers, you're growing new muscle fibers. So the easiest way to think about this is, if you have 2 bricks and they're separated by a certain distance and you attach rubber bands in the middle, they're going to come to an equilibrium. If you add more rubber bands, those bricks are just going to get pulled closer together because there's more tension there. It does the same thing with your core. It does the same thing with your butt. It helps with your butt because by increasing that tension, it helps to lift your butt. With your core, it brings your abs tighter and more pulled in, which helps to improve core strength and improves posture. It decreases low back pain, but also it tightens up your tummy and makes it look better. And in my experience, on average, people who do Emsculpt on their tummy tend to lose anywhere between 2 and 4 inches off their waist pretty quickly after a period of 2 weeks, and they maintain it for about a year. So it is a very effective, long-lasting treatment to help to kind of tighten up and define and tone our abs. It's a no downtime procedure. It's not painful. It does feel a little bit weird because you have a muscle or a machine that's contracting your muscle for you. So it can take 30 seconds to a minute to get used to that feeling where I don't have to do anything. I can relax and let the machine do the work. But once you're done with your 30 minutes, that's 20,000 sit-ups. You just got a really good workout in, so you don't really have to worry about it. Now, the way that these two work together is Emsculpt does a great job of tightening and toning your muscles. However, if there's a thick layer on top of that, you're not going to really see as much. So combining the two of them, which has been something I've seen is really successful in my practice, really helps to tighten and tone the muscles, but then also show it, because we're getting rid of all of the dense fatty tissue that sits on top of the abs to help to kind of show the results of your hard work. And combining the two has really, at least in my experience, been a great way of kickstarting a kind of a new path or a new road to a new, healthier lifestyle. It can be really hard to start a diet. It can be really hard to start a new exercise plan. And especially in the new year, when people have all these New Year's resolutions and I'm gonna go to the gym and I'm gonna eat better, it's very hard to find that catalyst, that one thing that's going to actually start that wheel spinning. And Semaglutide is a great option for weight loss because it does just decrease your body's desire for all of those foods that we probably shouldn't be eating as much of. And Emsculpt is a really good way to kickstart the, okay, maybe I'm not really feeling like going to the gym yet, but this is a great way to get those muscles going and get them used to it, to say, okay, I've invested in myself with this. Now I'm going to keep that roll going. So again, these are two really nice, no downtime, very effective non-surgical treatments that we have here that work very, very well synergistically. If you have any questions about those, please DM us, call us, or leave a message in the comments. Thanks so much.